Myself, K. Pavithra, pursuing B.Sc Cardiopulmonary Proficient Care Technology at Snsahs College of Allied Sciences, Coimbatore. In this video, I am going to present a CLT presentation, which is one of the 5-pillar activity in our institutions. And I would like to thank our institution for providing a great opportunity to me. And also here, I would like to add some design thinking curriculum, which is empathize, define, ideate, prototype and test and evaluate. Come, let's move into the video. First, I will start with the empathize, which is understand the challenge and gather inspirations, prepare research. And here, I would like to add a case study. Here, 38 years old man presented to the emergency room 2 days ago with a history of left-sided flank pain that radiates to the groin. The pain was sudden onset, chronically in nature, progressive, and intermittent throughout the course of the illness. He also complained of sensation of incomplete voiding, oligo, and total hematuria with no clots. There was associated with nausea and vomiting, but there was no dysuria and fever or chilliness. The upcoming topic comes under the design thinking curriculum, which is define. Define means frame opportunities, search of meanings, telling stories. And here, introduction. Kidney. Kidneys are a pair of excretory organs situated on the posterior abdominal wall. Left kidney is slightly higher than the right kidney, since the massive liver occupies the right space. Structure of the kidney. Microscopic structural and functional unit of the kidney is nephron. The kidney is a bean-shaped structured organ with a convex and concave borders. Each kidney weighs about 150 grams in a male and 135 grams in a female. Both the kidneys together receive blood flow of about 1200 ml per minute. The kidneys are encased in capsule layers of fascia and fat. Functions of the kidney. Kidneys excrete variety of waste products produced by metabolism into the urine, regulates acid-base balance, electrolyte concentration, extracellular fluid volume, and blood pressure. Kidneys mainly secrete a variety of hormones including erythropoietin, calcitriol, and renin. Regulation of osmolarity. Ureter. The ureter is a tube that carries urine from the kidney to the urinary bladder. There are two ureters, one attached to each other. The upper part of the ureter is located in the abdomen and the lower half is located in the pelvic area. Urethra. The tube that through which urine leaves the body. The empties urine from the bladder. Anatomy of the distal and proximal urethra. Urine flows out of the bladder and leaves the body through the urethra. The urethra is about 8 inches long in men and about 1 to 1.5 inches long in women. Urethra. The urinary bladder is a temporary storage reservoir for urine. It is located in the pelvic cavity, posterior to the symphysis pubis and below the parietal peritoneum. The size and shape of the urinary bladder varies with the amount of urine it contains and with the pressure it receives from the surrounding organs. Urethra is also mainly used for the excretion of urine from urinary bladder. Let's move into the assessment session. First question. Anatomical position of the kidney. Second one. Variety of hormones secreted by kidney. Third question. Blood received by the kidney.
Answers for the assessments. Anatomical position of kidney. Posterior to the abdominal wall. Variety of hormones secreted by kidney. Erythropoietin, calcitriol, renin. Blood received by the kidney. 1200 ml per minute.
Renal Calculi. Definition. A kidney stone is a hard, solid mass of material that forms in the kidney from the substances in the urine. Kidney stones are calculi develop as a result of various metabolic disorders which affect the fate of calcium and other mineral elements in the body. Stones may be formed in the kidney, urinary bladder, ureter, and urethra. A kidney stone, also known as renal calculus or nephrolith, is a solid piece of material which is formed in the kidney from the minerals in urine. The upcoming topic comes under the different thinking curriculum, which is ideate, refine ideas, and find ideas. Causes. Kidney stones are most likely to occur in people between the age of 20 and 50. Gastric bypass surgery, a diet with high levels of protein, salts, or glucose, taking medications such as triamytrine, diuretics, triazurine drugs, and calcium-based antacids. Differential diagnosis. Abdominal abscesses, biliary colic, acute epididymitis, gallstones, renal cell carcinoma. Symptoms. Urinary small amount of urine, fever, chillness, blood in the urine, frequent need of urinate, nausea, vomiting. The upcoming topics are comes under the prototype and test. Get prototypes and get feedbacks. Diagnosis: blood test for calcium, phosphorus, uric acid and electrolytes. Blood, urea, nitrogen and creatinine to access kidney diseases. Urine analysis, MRI scan, ultrasound, abdominal CT scan, intravenous pyelogram, retrograde pyelogram. Prevention: stay hydrated, eat less sodium, eat more calcium rich foods, eat fewer oxalate rich foods, eat less animal protein, avoid vitamin C supplements, explore herbal remedies. The last and final topic in our design thinking curriculum is evaluate. Evaluate is track learnings and find forward. Treatments: majorly medications. In medications, allopurinol for uric acid stones and thiazide diuretics to prevent calcium stones from forming. Sodium citrate to make the urine less acidic. And last one, acetaminophen for the pain relief. And also some more treatments are there, which is lithotripsy, tunnel surgery and uteroscopy. Let's move into the assessment session. First question: what is renal calculi? And second one is renal calculi is also known as. Third question: differential diagnosis of renal calculi. Fourth question: medications used to prevent calcium stone forming.
As for the assessments, what is renal calculi? A kidney stone is a hard solid mass of material that forms in the kidney from the substance in the urine. Second one, renal calculi is also known as kidney stones. Differential diagnosis of renal calculi: abdominal abscesses, biliary colic, acute epididymitis, gallstones, renal cell carcinoma. Medications used to prevent calcium stone forming: thiazide diuretics.
I would like to thank our institutions for providing a wonderful opportunity. Thank you all.